Shame has no place in your pelvic floor. So I'm a women's health physical therapist, and shame gets in the way of healing people's pelvic floors. So shame has no place in the pelvic floor. I have had women that have had vaginismus or hypertonic pelvic floor that need internal work or need to use a dilator, or as I effectively call it, spacer, and won't do it because of fear of what their husband will say, or because they believe that there is shame involved because of their religious beliefs. Yes, their religious beliefs affects their pelvic floor. So when I say shame has no place in your vagina, I'm dead serious. I have people that come to see me that have terrible pelvic floor pain, that have urinary incontinence, and there is a lot of shame attached to it. And I always try to explain to people that I appreciate that they are coming to me and that they pick me as their healthcare provider, but know that I am not a person who's going to judge you. I'm going to help you, and I'm going to look at your pelvic floor objectively. We're going to look at your strength, we're going to look at your muscle tone, we're going to look at your fascia, we're going to listen to your complaints of pain, and we're going to ask questions about when it increases. What can you do to decrease it, just like I would with any other part of the body? My hope is to take all the uncomfortable feelings of shame out that I can during that assessment. So I always say that women's health physical therapists are the best allies for people that have pelvic pain and dysfunction. Because when women are assaulted, they have a very different pelvic floor. And if you are a woman that have these problems and you think this sounds like you, I want you to see a women's health physical therapist and find one that works for you, because you don't have to live in pelvic pain and you don't need any shame, because your vagina is just that, yours. Anybody else's opinions of your vagina doesn't matter. Technically, not even mine. Even the person who would assess it and grade your pelvic floor strength and help you form a plan. You are the only person that matters with your vagina. So if you have pain with intercourse, if you have pain with walking, deep pain vaginally, if you have nerve pain vaginally, if you feel like there is a needle going through the head of anything, that is pelvic floor dysfunction, that is nerve entrapment, that is pelvic pain, and you need to see your doctor and a women's health physical therapist, and there should be zero shame. None.